Leader of this party.
Mr. Speaker, it was 5 months ago, on July the 12th, that a constituent of mine died in the crowded ER waiting room at the Chalmers Hospital. On November 22nd, another patient died in the ER waiting room of the Moncton Hospital while it was in a state of critical overcapacity. In the first case, the Premier fired the CEO of Horizon, dismantled the board, and shuffled the Health Minister out of her portfolio. In the second case, nothing. In July, the Premier committed to publicly releasing the findings and recommendations of the death review at the Chalmers. He has not done so. For years, our ER doctors have repeatedly and publicly warned that critical overcapacity in our ERs will result in deaths. Mr. Speaker, why has the Premier done nothing to keep people from dying in the waiting rooms of our ERs?
The Minister of Health.
Well, Mr. Speaker, it's unfortunate that the member opposite has taken such a sensitive issue and made it a political issue. Mr. Speaker, we know that there's people in our healthcare system, day in and day out, that step up and try to do as much help as they can. And Mr. Speaker, sometimes the outcomes are unfortunate, and we sympathize with the families and friends of those people who don't have a good experience in the ERs or in hospital. But Mr. Speaker, we are taking that serious. Mr. Speaker, we are working with the RHAs, Ambulance New Brunswick, Medicare, and trying to make moves with them to assist the congestion in the emergency rooms. Whether it's a number of the initiatives that I talked about earlier, like trying to focus on primary care out in the communities to allow people to access that primary care so they don't end up in the emergency room. And that, Mr. Speaker, we're also working with our other members here, whether it's education, recruitment, working in helping seniors get to the care in the community. Mr. Speaker, a number of initiatives are taking.
Member for Fredericton-South and Leader of this party.
Speaker, we know there are many New Brunswickers who lack doctors or nurse practitioners. Many that have primary health care providers often have difficulty getting appointments in a timely manner. In fact, Mr. Speaker, so often the phone message on the other end at the doctor's office tells them to go to the ER if the concern is urgent, to go to the ER, which are chronically in overcapacity and understaffed. Mr. Speaker, the tragic truth is it's easier to access health care for your cat than for your children in this province right now. Our RHAs operate 14 community health clinics staffed by multidisciplinary healthcare teams and 3 large clinics staffed by nurse practitioners in our biggest cities, yet few of those clinics, Mr. Speaker, even take walk-in appointments. Will the Health Minister commit to requiring all of those clinics to treat walk-in patients, to take walk-in patients, and resource them accordingly to alleviate the pressure on our ERs?
Minister of Health.
Mr. Speaker, this government has a provincial health plan, and that provincial health plan has a number of different platforms. Whether it's working the seniors to making sure they get the care where the care is best for them and their needs, whether it's working with the primary care network system in trying to make sure that people have access to primary care when they need it, where they're needed. And we know that we continue to have a population that's aging, that is getting sicker, that has more acute illnesses. And again, that's why we are working with the RHAs, with the College of Surgeons and Physicians, with our various associations in trying to make sure that our human resource assets are recruited and are working on the RHAs. We've created navigators to work through the system. Mr. Speaker, yesterday I was in Lamec at the Community Health Centre in Lamec, which is undergoing renovation, significant investment, and I talked to the front care workers, I talked to the NPs, I talked to the doctors. Mr. Speaker, again, what is happening in the province of New Brunswick is trying to address that